The word tumescent means swollen and firm. It comes from the Latin word tumescere, which means to cause to be swollen. The word tumor means that there's a swelling and a firmness growing on the body. This is a word that was present for hundreds of years before modern medicine. So before they could diagnose a cancer, a patient might see, or a doctor might see, a tumor on the skin or growing somewhere under the skin. So tumor and tumescent means swollen and firm. So I've adopted that to this drug delivery technique. That means you put in so much local anesthesia that the tissues become swollen and firm. And as a consequence of that swelling and firmness, the fluid is spread throughout a large area of the tissue and stays there as a reservoir of fluid, and it becomes very effective. So in the end, there's a new form of regional or local anesthesia that is called pure sensory regional anesthesia. Nerve blocks that are given by anesthesiologists block both the sensory nerves and the motor nerves. So not only you have no pain, but you can't move the arm or leg when it's treated with a nerve block. We can use tumescent anesthesia to give pure sensory regional anesthesia with no effect on the motor nerves or the muscles. Anywhere on the body, pure local anesthesia, very effective. That's a different thing than nerve blocks, which rely on the location and the course of a nerve. You name an area on the body, it doesn't matter where the nerves go, you can anesthetize that in a large area. So that's pure sensory regional anesthesia. And you can put a drug in there, you can have pure sensory regional anesthesia with localized targeted drug delivery. Things that I'm excited about is that I think one can use tumescent drug delivery to prevent metastases of certain skin cancers or breast cancers. So if one has a breast tumor and before a mastectomy, one can inject tumescent drug delivery of the anti-cancer medications or biologic drugs into the breast before the surgery. The fluid in there and the drug will be absorbed by the body and will be specifically absorbed by the lymphatic channels and take that drug right to the lymph nodes. And the lymph nodes will be targeted with this drug. And that's a very exciting possibility. It's not only does the mastectomy occur with no blood loss and no postoperative pain, but you also have the possibility of preventing metastases for a very scary disease.